Hi everyone. We are having a monthly April Instagram live on the issue of fatigue and treating fatigue the Sklar Center way. I want to tell you about how I approached fatigue in the past when I was a conventional OBGYN doctor. I remember now somebody coming in to tell me that they were fatigued, and I didn't know much of anything to do about it. I mean, pretty much in conventional medicine, you check two things. One is thyroid function, okay. And we didn't have the criteria that I have now in functional medicine for really evaluating thyroid function. And then the other thing we would do is see if the person was anemic, which happens to women, especially if they have heavy menstrual periods. But most of the time, people were not anemic or having low blood. And then after that, I didn't know what else to tell them. And what we often see, especially with women, because women are thought to be still hysterical and emotional more than men, is if a doctor can't figure out why you're fatigued, they'll recommend an antidepressant. And I hear that very often in my practice, that people say, well, I'm not depressed, I'm tired. And certainly one of the symptoms of depression can be like a lack of initiative and lack of wanting to do things. But that's different from being tired or fatigued. So I want to go through with you today some of the different causes of fatigue that we treat at the Sklar Center, and also answer some questions that are common questions. And if you have any questions, put them in the chat and I will try to get to them also. So fatigue is the most common reason that people come to see us at the Sklar Center. And I would say one of the most common reasons for fatigue is low hormone levels. Many of our hormone levels decrease as we age. And a lot of aging is written off to, oh, well, that's how it goes and you're just going to have to live with it. And what do you expect at your age? And really, I feel like people should be able to feel vibrant and resilient and have the initiative to do the things they love at any age. So one of the things we look at are hormones. Thyroid hormones are one of them. And the conventional medical system usually only checks the following two hormones: levothyroxine, or rather T4 thyroxine. Levothyroxine is a medication. They check your thyroxine level and they check your thyroid stimulating hormone level, or TSH for short. And the TSH reference range is a huge wide range. Normal is anywhere from about 0.5 to 4.5. And what that means is that's where 95% of the population falls. It does not mean that's where people are when they're feeling their best. And even the Endocrine Association in America has said 4.5 is too high, because the higher your thyroid stimulating hormone, the lower your actual thyroid function. So thyroid stimulating hormone is a message that's sent from the pituitary gland in the brain to your thyroid gland in your neck to tell your thyroid gland how much thyroid to make. It's a messenger, like all hormones are messengers. And so if your brain thinks there is not enough active thyroid hormone in your circulation, it will send out more of these messages, more of this thyroid stimulating hormone, to try to get your thyroid gland to make more hormone. So the higher the TSH, the lower functioning your thyroid is. We like TSH to be around 1 or 2, which is what the Endocrine Association of America has as their goals also. By the time you're up around 3 or 4, even if it's in the reference range, you probably don't have enough thyroid hormone in circulation to feel good. And I remember one particular patient years ago who was 18 years old. She was young, and she came to see me about her thyroid, and she brought me her medical records, and there was a letter from her endocrinologist to her primary care doctor who had referred her, and it was a UCLA endocrinologist, so very well trained. And the letter from the endocrinologist said, so-and-so thyroid function appears to be normal on blood testing, but she complains of, and I have to tell you, that's the medical term for when you have symptoms or problems. Medically, it's called a complaint. So he said she complains of fatigue, hair loss, coldness, and constipation. But her thyroid tests are normal, so we're not going to change anything in her treatment. And she came to see me, and first of all, they hadn't checked her active thyroid hormone level, which is free T3. So T3 is your active thyroid hormone, and the T4 that normally gets measured on conventional testing has to convert into T3. And if you're not a good converter, your T3 level is low. And so why might you not be a good converter? If you're really stressed, you don't convert as much, or you actually convert some of that T4 into something called reverse T3, which actually blocks your active T3 hormone from doing its job. If you're low in certain nutrients like selenium, zinc, or iodine, you will not be able to convert T4 into T3. So this young woman had, quote, normal lab levels, but almost every symptom of low thyroid function possible. And she wanted to go to dental school, but she didn't have like the brain power and the energy to figure out how she was going to get through it. And when I actually saw how low her free T3 is, I could see why she had all of those symptoms. Classic symptoms of low thyroid function: sluggish brain function, fatigue, constipation, feeling cold all the time, dry hair, dry skin. She had them all. And when we provided the T3 that she needed, it was like she woke up and she got her energy back. She went on to dental school. So I'm giving this to you as an example of how the conventional medical system approaches thyroid and really fails in truly evaluating it properly and treating it. And so that is probably one of the most common reasons for fatigue that we see. And this young woman was 18 years old, so that wasn't even an age-related issue, although thyroid function seems to go down as we get older. There are some other hormones that are really important for energy. One of them is DHEA, dehydroepiandrosterone. It's a really long name. And a lot of you may be familiar with DHEA. It's a supplement. You can get it over the counter. And levels of DHEA are probably the best when we are between age 25 and 30, when we're at our really hormonal optimal. We should be. And it goes down through life. And so by the time you're in your mid-40s, it is half of what it was between age 25 and 30. By the time you're in your 60s, it's a quarter of what it had been. Now, DHEA is a really important energy, vitality, resilience, immunity, blood sugar regulation hormone. And when we replace it and see levels come up into the young adult healthy range, people's energy starts getting better. Some other hormonal reasons for fatigue are in perimenopausal and in menopausal women who are getting hot flashes and night sweats that disrupt their sleep. And, you know, people always make jokes about menopausal women are always fanning themselves and they think it's funny. But you know what? Hot flashes are not funny, and they are disruptive of sleep. They can be disruptive of your daytime function. And with lack of sleep and sleep interruption, fatigue can occur the following day. So, and that lack of estrogen, which causes the hot flashes and night sweats, happens with the perimenopause and menopause. We also lose progesterone when we become menopausal. And progesterone is very brain calming. So progesterone helps your sleep, it helps you get into deep sleep, and it helps your brain stay sedated during the night. And we lose progesterone with menopause, and we lose that calming effect. And I hear about that a lot from women that come to see us who not only are having sleep issues, but notice that they're having more anxiety. Or if they had anxiety previously with menopause, now they're having full-blown panic attacks. And part of that is due to this loss of progesterone, which is very brain calming. So you can see there are a lot of hormonal reasons why people can feel fatigued. And restoring those hormones helps most of those people. So what are some of the other issues that we see that cause fatigue that are not hormonal? For one thing, autoimmunity is associated with fatigue. And so undiagnosed autoimmune disorders can cause a number of symptoms: joint pain, rashes, and fatigue can be one of them. So dry mouth, dry eyes, these are all various symptoms of autoimmunity. Other causes for fatigue are toxins from the environment. And so one of the questions I got is what's happening in our body when we experience fatigue? And I'll go ahead and answer it now because it's a natural segue. When we're experiencing fatigue, our biochemical processes are not happening at the rate in which they normally should happen. And that includes the manufacture of energy. And the energy in our cells is made in a little area of the cell called the mitochondria. And the mitochondria are actually a leftover from prehistoric and before, remnants of a virus actually. And mitochondria have a little energy factory in it. And the energy factory turns glucose or other sugars into energy. There are a number of steps in that process, and they require a lot of different cofactors. So magnesium is one of the cofactors. Coenzyme Q10 is a cofactor. Carnitine is a cofactor. So if you're low in any of these components, your little factory that's supposed to be spewing out what's called ATP, adenosine triphosphate, which is energy, the factory's not working. And why might somebody be low? There are a whole variety of reasons. Statin medications, which are used to lower cholesterol, prevent you from making cholesterol, so it'll lower your blood test. But the same enzyme that you block when you're on a statin medication also helps your body make coenzyme Q10. And so many people on statin medications are low in CoQ10. And it can come out in various symptoms. Fatigue is one of them. Muscle pains and aches and weakness are very common with statin medications. And I actually just had a friend tell me that he was having terrible muscle fatigue and feeling awful on his statin medication, and his doctor had switched him around to all different kinds and put him on the one that was the least likely to do it, and he couldn't tolerate it, and so he was off of it. And he's somebody who really needs to be on it for a variety of reasons. And I said, well, did your cardiologist talk to you about CoQ10? And he said, no. So cardiologists don't seem to understand the biochemical step that causes statin side effects. So you know it now, and so you know that if you need to be on a statin medication, and you should be on CoQ10 along with it. What other things can cause fatigue? Toxins in the environment. So toxins, heavy metals, pesticides, organic pollutants that off-gas from our new cars and new carpets and paint get into our system and gum up the works and prevent that factory, that ATP energy producing factory, from working optimally. So toxins are an issue as far as fatigue goes. And one of the questions I got are fatigue and sleepiness the same thing? And I would say no. Sleepiness is kind of like more like you want to fall asleep and your brain isn't moving fast enough, And fatigue is more of an energy issue. So something needs to be done about either one of them if they're an issue for you. Other problems that can cause fatigue are problems with sleep. And so we see a lot of people with insomnia, and there are a whole lot of reasons for insomnia. And I mentioned one before, and that is lack of progesterone. Other reasons for insomnia, anxiety, and there's one expert that says there's no insomnia, there's only anxiety. So we know that meditation, and there have been hundreds of studies that show that meditation improves sleep, and it reduces anxiety, calms your brain, and calms your cortisol levels. The other thing about sleep is you want to have what we call good sleep hygiene. So you do not want to be looking at bright screens on your computer or your TV within an hour or two of bedtime. You want to dim the lighting. You know, it's hard for a car to go from 100 miles an hour to a full stop. It's hard for you to go from 100 miles an hour during your day to a full stop all of a sudden at night. So having a wind down period where the lights are dim, where you do something relaxing. You might meditate, you might read, you might listen to music. If you have to be at a screen, you can use blue blocking glasses, which are kind of like fit over. Well, if you wear glasses like I do, they're fit overs or not, of a yellow glass that blocks out the blue light that comes from our screens, that inhibits our pineal gland's manufacture of melatonin, and melatonin is our sleep hormone. The other things that insomnia can be involved with is lack of adequate oxygen at night. So if you are somebody who snores, there is a pretty high likelihood that you may not be oxygenating well at night. And for women, this is especially important because it's, like many things, harder to pick up on than a lack of oxygenation and sleep for men. So the classic person with sleep apnea we think of as a man with a short, fat neck, and as soon as he lies back, all those tissues press on his trachea and block air coming in. And so that's easy to evaluate. Women, however, have other sleep problems, and one of them is called upper airway resistance syndrome, where women who look like me with a long skinny face and a long skinny neck have a thin trachea. And when we lie back, that trachea may narrow to just like a 1/16 of an inch, like not enough for enough air to get through. It's usually worse when people lie on their back. So a lot of people think that they happen to like sleeping on their side, one side or the other, or their stomach. But in fact, it may be your body telling you this is the best way that you can get oxygen without you even really being aware of it. It's a natural thing that your body does to get you more oxygen. So if you're a snorer and you're fatigued, it's really important to get a sleep study. The other thing I found out is women who have this upper airway resistance syndrome have a lot of symptoms that overlap with menopause. Hot flashes and night sweats, mood problems, and like I said, fatigue. So it's important to get a sleep evaluation if you're fatigued and you are snoring. Another question we got is, I feel fatigue shortly after I eat. What could be happening? And we usually see this with high carbohydrate meals. It's an indication of insulin resistance. So insulin is a hormone that our bodies produce when we eat, and it is used to get the breakdown products of our food, which is glucose, into the cells. And if we are insulin resistant, it's like you have a creaky gate on a fence. It's like really hard to push the gate if it's rusted. And it takes more insulin to open that gate and let the glucose into your cell. And that will end up giving you a feeling of fatigue after eating. The other thing that I want to mention that is really important is the issue of adrenal fatigue. And what is that? Well, our adrenal glands are glands that govern a lot of different things. And we usually think of them as our, red light emergency glands. So we have evolved to be able to respond to an emergency, like a predatory animal wants to eat us, and so we have to think fast, act fast, and have the muscle power to get the heck out of there, right? So that we don't get eaten by the predator. And that all happens because of the release of cortisol as well as adrenaline. And adrenaline, of course, gets your heart racing, gets your blood pressure increased. That pumps your blood around more quickly so your muscles can function better, because in prehistoric times when this whole system developed, our main threat was from predators, and our main action was a physical action to run away. These days, we get stressed. Our bodies actually have the same physiologic responses when we're out in the jungle running away from predators, but we don't run anywhere. Like, you sit in traffic stewing about traffic, getting the same rise in cortisol that you would get if you had an animal about to eat you. But what are you doing? You're sitting there stuck in traffic. You get no physical release and change in your hormone levels, that kind of recovery in modern times. And so what we see is, with stress in our lives, we release a lot of cortisol. And cortisol does a number of things. It is a fat storage hormone. It is a wake-up hormone. And one of the problems we see is with stress, sometimes the evening cortisol levels, which should be the lowest of the day to allow us to fall asleep, are really high. And when your cortisol levels are high, it's like you're tired but wired. You cannot let go and fall asleep. And we have ways of diagnosing that with doing cortisol tests throughout the day. And our favorite test right now is a urine cortisol, which is done on a small filter paper at 4 different times during the day. And your cortisol level normally should be the highest between about 4 and 6 in the morning. And that is what starts to wake you up from your sleep. And then it goes down at noontime, and there's a little blip up after you have lunch. And then it goes down further at about 5 in the evening, and then you eat dinner, there's a little blip up. And then it's its lowest between 10 and midnight, and that's what allows you to finally fall asleep. If you're somebody who has been stressed over a period of time, you may have an inverted curve, and instead of having high in the morning and lower through the day, you may be low in the morning and go up during the day, so that by 10 o'clock to midnight, your cortisol levels are high. And you can't fall asleep if your cortisol levels are high. You need a sledgehammer to knock you out if your cortisol levels are high and you're trying to go to sleep. So evaluating adrenal function, which is the gland that produces cortisol, turns out to be very revealing in terms of fatigue. And after somebody has gone through a high stress period where they're producing a lot of cortisol and might have that nighttime surge, and that's a classic actual pattern that we see, where someone will say, I get really tired in the afternoon, and then all of a sudden, when I should be going to sleep at around 10 or 11 o'clock at night, I'm wide awake and finally have the energy to do something. So then they're busy trying to do everything they couldn't do during the day, and now going to sleep at midnight or 1 in the morning, which is too late if you need to get up the next morning. So what we need to do is to try to reverse that inverted cortisol level of hormones. And we have a number of ways of doing it. We have a supplement that we really like at the Sklar Center called Serifos, and it is phosphatidylserine, and it helps to blunt that high cortisol response. So it's something that we use in people who have high cortisol at night while we're trying to work on their stress issues and getting that cortisol, the root cause of that cortisol, to come down. If somebody has had high cortisol levels for a really long time, after a while there's a disconnect between the pituitary gland, which again governs your adrenal glands. It governs all your glands. So your thyroid we talked about, now we're talking about your adrenal gland. And there can be a disconnect between the pituitary and the adrenal gland, so that the adrenal gland no longer produces enough cortisol. And you go from a high cortisol state to a low cortisol state. We call this adrenal exhaustion. And the people who have this are tired, even if they wake up from what they think is a really good night's sleep. And they get more tired as the day goes on. So regardless of how they sleep, even if it seems good, they're tired on awakening, and it just gets worse as the day proceeds. So very difficult situation to live with. And we have lots of things that we do for that. We actually have adrenal glandular, so similar to what we might give for thyroid replacement if somebody needs it, is a pig-derived thyroid gland product. We have cow-derived adrenal gland products that help your body recover, not just a replacement, but actually recover from adrenal exhaustion and adrenal fatigue. We sometimes even use a pharmaceutical called hydrocortisone, that is like the cortisol that your body makes but is not making enough of. And we use it short term, maybe 3 to 6 months, to help your body while it's recovering. And I would say Dr. James Wilson wrote a book called Adrenal Fatigue, the 21st Century Illness. And in fact, it is, because we are so stressed. And that was even before the pandemic, which has caused even more stress. Let's see, some other questions. Somebody asked, is it normal to experience a midday slump, and what can you do about it? It is part of our natural decrease in cortisol levels. Like I said, between noon and 5, cortisol levels go down. And so that, besides people who have adrenal problems, that can be part of a normal diurnal variation in energy. What you should not do is use caffeine, which of course a lot of us do, to help us get through. And it's understandable, because caffeine gives you a short jolt of energy, and it actually is what's called a nootropic. It helps your brain work better short term. But if you use that as your only method and don't start looking at the underlying causes, you can end up in even worse shape, because you're kind of driving your body to keep going when it needs something else. It either needs rest, it needs adrenal glandulars, it needs phosphatidylserine, it needs a good night's sleep. So if you're somebody who's having that midday slump, if you're able to, with your job or whatever your schedule arrangement is, to get up and move around and go for a little walk, especially if you can get outside, that is a really good way to boost your energy without driving your body beyond its capabilities. Somebody asked about whether fatigue can be due to dehydration. And I think we overlook this a lot, but your cells cannot work right if you don't have adequate hydration. You are making everything in your body function in a sluggish fashion if you're not drinking adequate fluids. And of course, our favorite fluid is water, or herbal tea, or water with a little lemon in it. There are a variety of things you can do. Some people put electrolytes in their water, but you really need to be drinking a couple of quarts of water a day for your system to function optimally. We have a question of, does fatigue come with brain fog, blurry vision, dizziness, or chills? I would say that's not typical of the fatigue that we see at the Sklar Center. And if somebody has that constellation of symptoms, we certainly want to look into viral illnesses, tick-borne illnesses. There is tick-borne relapsing fever and other tick-borne illnesses that will give you episodic fevers along with fatigue and chills. So that would be a more complicated situation, but certainly reactivated viral illnesses and Lyme and co-infections are really significant causes of fatigue that we see. And the reactivated viruses, the main one that we see is Epstein-Barr. An Epstein-Barr virus is almost ubiquitous in our society. By the time we're in our 20s, 90% of us have been exposed to the Epstein-Barr virus, and it's also called EBV. E for Epstein, B for Barr, and V for virus. And the Epstein-Barr virus, in your 20s, you might have had mononucleosis, or you might not have had any illness at all. And what typically happens after we've been exposed to a viral illness is our white blood cells, which is our fighting army for viruses and bacteria, will expand to fight the Epstein-Barr virus. And that will keep the virus from multiplying in our bodies and causing us to feel sick. After that initial infection, that big army of white blood cells is not maintained, and it shrinks back to a little group of cells that is at the ready if we should get exposed again. And what can happen later in life is, because our immunity is decreased due to stress, due to illness, due to toxins, our immunity goes down and we no longer have that little smaller shrunk down army. The army expands, and it means that we are now fighting the virus again. So the virus has been kept in check and now is multiplying and proliferating and making us feel bad. And it is a fairly common cause of fatigue that we see in our patients. We have good luck treating it. We prefer not to use pharmaceuticals, and it doesn't seem like it's been necessary for Epstein-Barr. We use a derivative of coconut oil, which has very few side effects and seems to be really effective. But it's not an instant treatment. It goes on for 3 to 6 to 9 months and sometimes requires a maintenance dose of it. And the supplement we like to use is called lauricidin. Lyme and co-infections turns out to be a lot more common than anyone has thought over the last 30 or 40 years. So we're seeing a lot of Lyme, and even without the fever and chills, people can have Lyme or one of the infections that ticks carry along with carrying Lyme. Lyme and its co-infections are hard to diagnose. They're what's called intracellular, so they go and hide and they don't travel around your bloodstream as readily as other infections, and so on a blood test can be hard to actually see a positive test. So we go through a number of layers of testing for Lyme. We'll start with Quest and LabCorp, since a lot of people's insurances cover it, and then we go on and do some specialized lab testing to look for these various organisms that can have, tremendous and drastic effects on our health. Let's see, other questions that we have. I'm going to do one more question, and that is experiencing fatigue normal? And like I said at the beginning, I don't write anybody off because of their age. I think you should be feeling good at any age, and there may be some age-related decline, but you should not end up sleeping all day just because you're getting older. And so we found that hormones in particular for older people have done a lot to help their energy. And I don't see any questions here. Let's see. I don't see any questions, so I am going to wrap up, and I want to thank all of you who are on listening and send waves, and hope to see you next time. Take care.